Energy medicine, energy therapy, energy healing, or spiritual healing are branches of alternative medicine based on a pseudo-scientific belief that healers can channel healing energy into a patient and effect positive results. This idea itself contains several methods: hands-on, hands-off, and distant or absent, where the patient and healer are in different locations. Many schools of energy healing exist using many names, for example, biofield energy healing, spiritual healing, contact healing, distant healing, Qigong, therapeutic touch, Reiki or Qigong. Spiritual healing occurs largely in non-denominational and ecumenical contexts. Practitioners do not see traditional religious faith as a prerequisite for effecting cures. Faith healing, by contrast, takes place within a traditional religious context. While early reviews of the scientific literature on energy healing were equivocal and recommended further research, more recent reviews have concluded that there is no evidence supporting clinical efficiency. The theoretical basis of healing has been criticized as implausible. Research and reviews supportive of energy medicine have been faulted for containing methodological flaws and selection bias, and positive therapeutic results have been dismissed as resulting from known psychological mechanisms. Edzard Ernst, formerly professor of complementary and alternative medicine at the University of Exeter, has warned that healing continues to be promoted despite the absence of biological plausibility or convincing clinical evidence. That these methods work therapeutically and plenty to demonstrate that they do not. Some claims of those purveying energy medicine devices are known to be fraudulent, and their marketing practices have drawn law enforcement action in the U.S. Energy healing relies on a belief in the ability of a practitioner to channel healing energy into the person seeking help by different methods: hands-on, hands-off, and distant or absent, where the patient and healer are in different locations. The Brockhampton Guide to Spiritual Healing describes contact healing in terms of transfer of healing energy and distant healing based on visualizing the patient in perfect health. Practitioners say that this healing energy is sometimes perceived by the therapist as a feeling of heat. There are various schools of energy healing, including biofield energy healing, spiritual healing, contact healing, distant healing, therapeutic touch, Reiki, Qigong, and many others. Spiritual healing is largely non-denominational. Traditional religious faith is not seen as a prerequisite for effecting a cure. Faith healing, by contrast, takes place within a religious context. The Buddha is often quoted by practitioners of energy medicine, but he did not practice hands-on or off healing. Energy healing techniques such as therapeutic touch have found recognition in the nursing profession. In 2005 to 2006, the North American Nursing Diagnosis Association approved the diagnosis of energy field disturbance in patients, reflective of what has been variously called a postmodern or anti-scientific approach to nursing care. This approach has been strongly criticized. Believers in these techniques have proposed quantum mystical invocations of non-locality to try to explain distant healing. They have also proposed that healers act as a channel passing on a kind of bioelectromagnetism which shares similarities to vitalistic pseudosciences such as orgone or Qi. Drew Leder remarked in a paper in the Journal of Alternative and Complementary Medicine that such ideas were attempts to make sense of, interpret, and explore psi and distant healing, and that such physics-based models are not presented as explanatory, but rather as suggestive. Beverly Rubik, in an article in the same journal, justified her belief with references to biophysical systems theory, bioelectromagnetics, and chaos theory that provide her with a scientific foundation for the biofield. Writing in the Journal of Bodywork and Movement Therapies, James Oshman introduced the concept of healer-sourced electromagnetic fields which change in frequency. Oshman believes that healing energy derives from electromagnetic frequencies generated by a medical device, projected from the hands of the healer, or by electrons acting as antioxidants. Physicists and skeptics roundly criticize these explanations as pseudophysics, a branch of pseudoscience which explains magical thinking by using irrelevant jargon from modern physics to exploit scientific illiteracy and to impress the unsophisticated. Indeed, even enthusiastic supporters of energy healing point out that there are only very tenuous theoretical foundations underlying healing. There are several, primarily psychological, explanations for positive reports after energy therapy, including placebo effects, spontaneous remission, and cognitive dissonance. A 2009 review found that the small successes reported for two therapies collectively marketed as energy psychology, emotional freedom techniques and tapas acupressure technique are potentially attributable to well-known cognitive and behavioral techniques that are included with the energy manipulation. The report concluded that psychologists and researchers should be wary of using such techniques, and make efforts to inform the public about the ill effects of therapies that advertise miraculous claims. There are primarily two explanations for anecdotes of cures or improvements, relieving any need to appeal to the supernatural. The first is post hoc ergo propter hoc, meaning that a genuine improvement or spontaneous remission may have been experienced coincidental with but independent from anything the healer or patient did or said. These patients would have improved just as well even had they done nothing. The second is the placebo effect, through which a person may experience genuine pain relief and other symptomatic alleviation. In this case, the patient genuinely has been helped by the healer, not through any mysterious or numinous function, but by the power of their own belief that they would be healed. In both cases the patient may experience a real reduction in symptoms, though in neither case has anything miraculous or inexplicable occurred. Both cases are strictly limited to the body's natural abilities. Positive findings from research studies can also result from such psychological mechanisms, or as a result of experimenter bias, methodological flaws such as lack of blinding, or publication bias. Positive reviews of the scientific literature may show selection bias, in that they omit key studies that do not agree with the author's position. All of these factors must be considered when evaluating claims.